Aloha! Welcome back to our weekly chit chat. Ali'i Nani MD Presents. I am Nurse Marie. I do the injectables, device, energy treatments here, and also I manage this med spa. But before we start, I just want to thank everyone who gave us positive feedback from our last week's episode with Hannah. This time around, we thought of doing another segment, but I am going to be interviewing our debonair acupuncturist here, Kai. Okay, this is Kai.
Hello, my name is Shu Kai, and I'm an acupuncturist at Ali'i Nani. Also, we run Spring Oriental Medicine. I'm an acupuncturist over here doing all kind of treatments, including body section, also facial cosmetic acupuncture as well. So we're gonna talk about today.
Okay, so the first thing that everyone wants to know is who is a good candidate for acupuncture?
Okay, acupuncture is good for everyone. Okay, including a teenage person until elderly. Yeah, any age actually.
And what are the most common types or conditions that you treat with acupuncture?
So far in United States, there's a lot of people who consider acupuncture treating very well for the pain management. And of course, pain management is one thing that's very effective and very you can see the result really quick. But at the same time, acupuncture actually treats for everything.
You've mentioned in your expertise that you do traditional acupuncture.
Right.
Is there such a thing that is non-traditional? What is the difference?
Okay, so traditional Chinese medicine is the way that describe the medicine of Chinese medicine. But traditional or not, because right now we're talking about acupuncture, we're talking about traditional Chinese medicine, which exists for over 1,000 years. Okay, this is why we use traditional, this name. Because right now, more and more people, even the modern medicine right now, they started to use acupuncture or some method, for example, cupping. Okay, that's including some technology and also some of those theory that have our anatomy theory and also combined with some modern medicine. For example, some injection. Okay, those are something that we don't do long times ago, but now modern medicine, we started to do some injection as well. Okay, so that's the difference.
What kind of injection you do for that?
For me, I don't do any injection, and also over here in Ali'i Nani, we have
Dr. Reed.
Yes, we have Dr. Reed. We have a registered nurse over here to do those injection. But we're talking about in Chinese medicine. If you go to China, we actually do some herbal supplements injection as well.
Oh,
yes.
Okay. So yeah, you've heard it from Kai. So we have a medical doctor that does, of course, practice Western medicine. So how do you think doing acupuncture would complement with treatments that Dr. Reed is providing to our medical patients?
Okay, so yes, Western medicine, we have so many things that which is in the Western medicine system we already know. The good thing is acupuncture right now, there is a lot of things that Western medicine probably hardly to treating. For example, or give an example. Rheumatoid arthritis, okay, or osteoarthritis. Okay, those kind of arthritis, for example, let's say osteoarthritis. Due to those degenerative condition of your joint, that causing some arthritis condition. Okay, under Western medicine, for now, probably we have only some injection, some pain management from the medication. But in Chinese medicine, we can use acupuncture, which is a very good candidate for acupuncture. Okay, acupuncture can help for what we talk about meridian. Okay, this is something that we're gonna talk about later. But for example, the meridian right here. This is one thing's very different. Okay, we're gonna spend a little time to talk about this. All right, so why I'm carrying this model? Okay, this model is what we call meridian map in our body. Okay, so every channel, this is the major things about Chinese medicine and acupuncture. All right, all those meridian over here, just like our blood circulation, we have what we call meridian circulation, which is the energy circulation of your body. So on our body, you can see over here on our body, there's all kind of line drawing on our body right here. This is the energy pathway. So we have the energy pathway go through our body. For example, osteoarthritis on your knee. You can see how many channels go through our knee right here. Okay, so what we do as acupuncturists, we use those needles to connect to those energy pathway to sending the message to our body and sending the message to our brain, let our body to do the adjustment, okay, bringing more energy to a certain area. Okay, that's how the traditional medicine, a traditional Chinese medicine as acupuncturist to do for your condition. Okay, this is something that Western medicine probably hardly to do, but Chinese medicine can use this way to help you have a better condition and also recovering for the muscle or the joint.
Okay, so you talked about the needles, and actually a lot of people get scared with needles. In fact, I'm also a patient of Kai. The first time I did, I'm quite scared with the needles, but does it really, does it hurt? That's
No.
the most common question.
Yes, I know a lot of people who has the concept about needle, all right? But right now, because we are under Western medicine, we have those needles coming from probably your section needles. But traditional Chinese medicine's needles is something like this.
Very tiny.
Yeah, they are thin and fine.
Okay.
They are as fine as your hair. So when those needles insert into your body, you probably don't feel too much things. I have 99% of patient who told me there's no pain and not expecting anything like this before, which is better, a positive way to describe
Yeah,
it.
from a patient point of view, because like I said, I'm also his patient. I think it's really more of the fear of the unknown when I'm not gonna say inject. How do you say that?
Insert.
Insert. Okay.
Yes,
Because
insert.
I inject people. Okay. Insert. So I think it's just the fear of the unknown. But once the needle is in, actually, I don't feel anything. I think it's even more relaxing. But although when you twist that, what do you call that spring when you
The
twist
stimulation,
it?
yes.
There's a little bit of, I wouldn't even say pain, but you feel it. It's like an electric shock.
Right.
That's the way I would describe it with mine.
Right. The way you feel it is exactly what we talk about with those meridian. All those meridian and the points on it. With the needles, we'd be able to send a message. Okay, this message will all send back to your brain and let your body do the response. So I always tell my patient we're just a messenger, sending all this message to your body and your body do the adjustment. So this is how acupuncture really works. And that stimulation, it feels a little bit, but actually not something that make you uncomfortable.
So this one is interesting. You gotta explain it to them because I had you treat my neck and even my foot before, and it's not even related to my quality of sleep. How come on that week or even on that day, I had like really the best sleep of my time, and that wasn't even my complaint. How did it affect my sleep?
Okay, so that's another things about the meridian. The wonderful things about meridian. Every single channels over here, again, this is the foundation of acupuncture. Every single channels over here that actually connect to different system of your body. Every single points over here not only working locally for your condition, but also that connect to a different part of your body, and also it help you on your different system. It help your system adjust on different way. So, for example, the neck issues over here, there is a point over here that actually helping for your sleeping as well. Okay, that point in Chinese medicine way to describe it, the translation is called sleep well. So this is a point that actually help you not only benefit for your back muscles over here and also the neck issue, but also benefit your sleeping quality. So every single point has different function. Sometimes one point doesn't have only one, it's not mathematic, it's not one answer to one question. It's actually more benefit for one point.
Also, you've mentioned to me before that in China or in Taiwan, you don't have to be sick to do acupuncture. That
Right.
it's also promoted for wellness. Can you tell us more about it?
Yes, acupuncture is not something that until you're sick, until you have your symptom to get treated. Okay, in Chinese medicine, we have the idea of longevity. Okay, a lot of people actually having the treatments every week or sometimes every 2 days, 3 days. For what reason? For longevity. Because remember, our body just like the weather. They change all the times. Sometimes you just need a little adjustment. So acupuncture can really do in that. That's another thing, go back to the question you asked. what acupuncture, what Chinese medicine do compared to West medicine. Okay, Chinese medicine actually doing more for longevity, okay, for the prevention of the illness. Not until it gets sick, you started to treat a symptom. So this is a little main difference between Chinese medicine and West medicine.
Okay. Now, here's an interesting question, because we all know that here at Ali'i Nani, we do aesthetics. Now, how can acupuncture do cosmetic procedure?
That's a very good one. Okay, back to our little model here. You see how many points on the face right here? And every energy channels actually go back to where? To your head and your face. So every single channels over here, you see how many colors, even different colors indicate different system. Okay, so you see how many points actually connect to your face. So in Chinese medicine way to describe it, we can use all the point to open up every channels, which bring all the energy back to your face. So imagine when you are 20 years old, you have great energy. That's the times you have your facial expression the best. You have all those condition best. But when you get started aging, what's causing the issue? Because you're getting weaker, right? Your energy level is lower. So what we do is actually, in Chinese medicine way to describe it, we bring all the energy back to your face, and then you with the needles, we're leading all the energy back to your face. And that way you have the better energy go on your face, just like you're younger, you have greater energy. So that's how acupuncture does.
So you use the same needle for the face for the rest of the body?
No, needles face, I don't carry it with me now. But actually I do have one that I can use.
Is it like smaller?
Yes, it's even smaller. I don't know if you remember the one that we used earlier. Okay, this is the one even smaller compared to the regular needles right here. So you can see the face needles that usually even, they're half or even 1/3 of the size of the regular needles. So yes, of course, those are very, very thin needles. When you insert needles, you probably don't feel too much. Yeah, you probably don't feel too much.
Yeah, well, I would be interested to try that, because all treatments here I want to try, especially if it has to do with the face. Now, I remember one time you taught us something about pressure. Was that acupuncture?
Acupressure, yes, acupressure.
So Kai will teach us how to do acupressure. And what is it for again?
A lot of different, like I mentioned to you earlier, this is the foundation of acupuncture, right? All the energy pathway, and if you see all these points on the channels, every single point has a different function. Sometimes you don't need the needles to stimulate it. Needles bring a stronger stimulation, but you can use acupressure. Okay, you can use your fingers to push on certain points, can actually bring you the function to the system. So that can stimulate and sending the message to your body as well. Just you need to use a very, we just need to have a little stronger stimulation for different kind of method, for different kind of reason, okay? For example, that times we're talking about is for your headache.
So what I will do is, can you show us? I will actually follow, okay.
Yeah, headache over here is actually one point. If you want to locate this point, it's a very good point for migraine headache, okay? I'll show you how the channels goes to, but right now, if you close your fingers and index fingers, thumb and index finger, there will be a pop outs over here on your palm, okay? And the highest point, if you push down, you will find those very soreness point.
Am I doing it right?
Right here, right here, yeah. You will find those very soreness point. And this point is this one, right here, okay? And if you're following these channels, we go up all the way from here, and where it leading to, it should actually go up to your face.
So this helps with headache?
Yes, this point is a very general point for our headache condition. If you have a migraine, this
just press it.
will help you. Yes,
so
this point will help you to
every time I get headache, I will just do that.
Yeah, there's all kind of headache first.
Yeah. For example,
Yes.
I'm at the office. I
Yes.
just wanna I wanna feel relief from headache. I just press that. For how long?
Yeah, you just need to push it 5 minutes to 10 minutes. Just give a little gentle, If you're on the soreness point, find a gentle massage over here. A lot of time, not all the times. Again, a lot of reason to cause headache. But if it is like migraine headache, sometimes this will help you to relieve all those pain condition instead of taking the pain medicine. But if you want to use the medicine, this might be helps a little bit as well. So it will be combining those two and make it work better and make it work better.
Okay, well, that's good. Another question that I got asked is, do you take insurance for acupuncture?
So far, we don't take insurance in our clinic now.
Yeah, but what patients can do is, for as long as you are approved by your insurance, we can furnish you a copy of the receipt, and then you can submit it yourself. That's what we've been doing for some of our patients.
Right. Some company that actually offer just from the receipt, right? It depends on the policy you have.
Okay, and then also they can book online, which is, majority of the time that's what our patients do, book online, ali'inani.com, to make an appointment with Kai. And your hours are?
I'm actually taking all the appointments now. So anytime from
Monday to Sunday.
Yeah, Monday to Sunday, I'm open to every appointment. You just need to
Book online.
yes, book online, and then or you can just contact with us.
Yeah, because there's no walk-in. Yeah, it has to be booked
Yes,
online.
right now everything is appointment style.
Oh, okay. And then you have Instagram already. Yay!
Yes, we have Instagram. You can follow us at Spring Oriental Medicine.
Okay, well, that's good. So you'll be posting more, and then you will post this too.
Right. We will post more and started to let people know more about acupuncture.
Okay, well, perfect. So I guess today we've learned the basics of acupuncture, and then we interview Kai again next time, because he's gonna be discussing more things in regards to acupuncture and its benefits to us.
All right. Bye bye.
Bye.